Hello, Mr. Corder. How are you doing today?
Good, how about you?
Good. My name is Nick Davis. I am a doctor of physical therapy student at the University of the Cumberlands. So, okay if I work with you today?
Yeah.
Okay. So what we're going to do is I'm going to put this on you. It's called an abdominal binder. And while we're doing that, right before I put it on you, we are going to, I'm going to do a skin check on your backside and make sure that we're not developing any kind of wounds or anything, okay?
Okay.
All right. My technician, or Alex here, is going to help me out. He's going to have your head to make sure that we're following those precautions that you got, okay? So just a reminder here, Alex, so you're going to have his head cradled like so. Don't flex him, don't extend him, don't rotate. Well, you'll have to, I just want you to keep his head still in line with his spine and his chest, okay?
Okay.
So as we roll him to the left, keep his head in the same position. A good cue you could use is keep his nose right in the middle of his chest, so right there.
Okay.
Okay? Got it?
Got it.
Okay. All right, so I'm going to push this up underneath of you here first, Mr. Corder. We want it nice and low. That way the abdominal binder sits right underneath of his chest. That way we can keep all of his abdominal organs in, among other things, okay? You ready, Alex?
I got about my hands on you here?
Yeah. All right. You ready?
Yep.
All right. 3, 2, 1, roll. That's good there. All right, I'm going to lift your shirt up and look at your skin.
Yep.
All right, so the places that we're going to be looking for are going to be our spinous processes. You mind if I lift your your pants down?
Yes.
Okay. You do mind or you don't mind?
You're good. You can.
Okay. All right, so we're going to look at the sacrum. We're going to look at the thoracic spinous processes, the scapula, specifically the inferior border and the scapular spine. And then we'd also check the cervical spinous processes, the occipital protuberance, and the bottom of his heels, all that good stuff. All right, let's lay him back down. 3, 2, 1. All right. So now we'll put this binder on you here, Blake. Thank you, Alex. Feeling all right, Mr. Corder?
Yes.
All right. And there we go. That is the skin check and the placement of the abdominal binder. Thank you. Good afternoon, Mr. Binder. My name is Nick. I'm a doctor of physical therapy student at the University of the Cumberlands. What we're going to be doing is I'm going to sit you up. Right now you're laying down. I'm going to take a look at your backside, so that'll involve me moving your shirt and moving your shorts, pants a little bit. And then I'm going to let you sit there for a moment, and then I'll lay you back down, okay? Take good care of you. All right, so I'm going to get up underneath of your shoulders and a little bit of your neck. That way your head isn't going anywhere. We're going to lay one foot down and then the other. I'm going to go ahead and put that arm here. All right. So whenever I drop this leg down, you're going to sit up, okay? So 3, 2, 1. I got you. You may be feeling a little dizzy, but I'm not going to let you go. I'm right here with you. I'd be keeping a good eye on his stats, stats, look at me. His vitals, making sure he's not his blood pressure isn't dropping or his O2 stats aren't dropping, stuff like that. Letting him sit up here. All right. Assuming his vitals are good, I'm going to roll him over, make sure you're limp. So I'm here, I'm gonna check for his skin. I won't be able to check it really good, but I'm checking mainly his spinous processes. They look good. I'm gonna lift your shirt up a little bit more. His inferior borders look good. Scapular spine looks good. His spinous processes look good. And honestly, from this angle, I couldn't see his sacrum if I pulled his shorts up, so I'm not going to. All right, Mr. Quarter, we're gonna lay you back down here. So your head will be going back and your legs will be coming up. 3, 2, 1. All right, you take care. Hello, Mr. Quarter. My name is Nick Davis. I'm a doctor of physical therapy student at the University of the Cumberlands. You mind if I work with you today?
Yeah.
You do mind?
No, you can work with me.
All right, good deal. So what the plan is today, we're going to get you seated up in a chair, if that's fine. And then make sure you're doing all right. And we'll see where it goes from there, okay?
Okay.
All right. So what we're going to have to do first, I understand that your right arm is a little weak, is that correct?
Yes.
Okay, so what we're going to have to do is we're going to have to rely on our momentum to get us rolled over and then to get us up, okay? So we're really going to have to use this left arm to push off. So you're going to roll this way to me. It's going to help if you have your knees bent and you throw your arm over, and then you'll use this arm to push yourself up, okay?
Okay.
And then once you're seated up, I'm going to have to put this lovely thing on you here, and then we will stand up, and then we will shimmy, if you will, over to this wheelchair right here, okay?
Okay.
All right, wheelchair is locked on both sides, so we're good there. All right, so I'm here to give you whatever little help, whatever help you need, but what I want to see you do first is bend this leg here, good? And then I want you to use your momentum to whip yourself over, so roll over towards me, okay? Okay, good. All right, you feeling okay there?
Yes.
Okay, so now I need you to move both of your legs to where they're off the table, and then I want you to use this arm to push yourself up, okay? And I'm right here. So 3, 2, 1. Push, 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 push. Good. All right. Feeling all right?
Yes.
Dizzy at all?
No.
No? Not at all?
No.
Good. Good, good, good. All right. Do you feel like you're balanced? Do you feel like you can sit up there good?
Yeah.
Good. All right. I'm going to get this gait belt on you here. And this is just to make sure you don't try to get away from me. And it's also, if you were to fall or lose your balance, this makes it a little bit easier for me to grab you. You can still breathe?
Yes.
Good deal. All right. So I want you to scoot forward, that way your legs are off the bed. Okay. We're going to assume that he has grippy socks on. If not, then we'd get him shoes. Personally, I feel like this is fine getting you over to this chair since it's right there, okay? All right, so what I want you to do is use this arm and use the muscles on the front of your legs to stand up, okay? All right. Are you ready?
Yes.
You understand what you're doing?
Yes.
All right, 3, 2, 1. Stand, 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 stand. There you go. Good, good, good. All right. Are you feeling okay? Are you dizzy at all?
No, I'm good.
Okay. All right. So we're gonna turn to our to this side. So that would be your right side. So turn, turn, turn. All right. So now we're gonna back straight up into this wheelchair. So back up, back up. All right. Are you feeling the wheelchair behind your legs?
Yes.
All right. So you're just gonna take this arm and put it on the chair on the handle there, and then slowly put your butt down. Good. Slow, slow, slow. Good. Feeling all right?
Yes.
Good. All right. I'll loosen this gait belt a little bit because it can be a little loose, but we'll tighten it back up before we go anywhere. And yeah, there we go. That's the left MCA right-sided arm weakness bed to chair transfer. Thank you.